Hello, my name is Norma, and I'm a registered nurse certified in the administration of chemotherapy. The purpose of this video is to provide you with the information we feel would be beneficial in understanding the treatment plan your physician has ordered specifically for you. Patients typically receive cancer treatment in order to prolong the duration of their life or alleviate symptoms caused by the cancer and improve their quality of life. These potential benefits of treatment must be balanced against the risks of treatment. Some risks posed by various cancer treatments may include time away from family and friends, uncomfortable side effects of therapy, and/or long-term complications or death. It is important that you evaluate the risks and benefits of treatment within the context of the overall goal of receiving cancer therapy. Cancer. How does it start and spread? No one knows the exact cause of cancer, but according to most scientists, cancer develops in two stages: initiation and activation. The initiation stage is when healthy cells are exposed to inhibitors such as environmental pollutants, chemicals, ultraviolet light, radiation, cigarette smoke, and dietary fat. These are not by any means all the inhibitors. However, when any inhibitor breaks into a healthy cell, its mission is to alter the DNA. The new invaded cells could act out immediately, and others lie quietly for a period of time, even a year or more. When these initiated cells start to act out, this becomes the activation stage. Their mission is to multiply and form a new mass called a tumor. The surrounding tissues become invaded by the tumor, using the body's good nutrients while crowding out the healthy cells and changing the structure of tissues, causing the disease known as cancer. There are different ways in treating cancer once the devastation has occurred. The following information is intended to provide you with some basic knowledge of the services offered in our facilities. We are on your team in the fight of your cancer while providing the best possible chance of survival and quality of life. Chemotherapy is offered at Palo Verde facilities. Once you begin treatment, you will often hear chemotherapy referred to as chemo, which can be defined as any treatment involving the use of drugs to kill cancer cells. Chemotherapy may consist of a single drug or combinations of drugs and can be administered through a vein, injected in a body cavity, or delivered orally in the form of a pill. Chemotherapy is different from surgery or radiation therapy in that the cancer-fighting drugs circulate in the blood to parts of the body where the cancer may have spread and can kill or eliminate cancer cells at sites great distances from the original cancer. As a result, chemotherapy is considered a systemic treatment. More than half of all people diagnosed with cancer receive chemotherapy. For millions of people who have cancers that respond well to chemotherapy, this approach helps treat their cancer effectively, enabling them to enjoy full, productive lives. Furthermore, many side effects once associated with chemotherapy are now easily prevented or controlled, allowing many people to work, travel, and participate in many of their other normal activities while receiving chemotherapy. Being informed about chemotherapy and its potential side effects can help you to proactively manage your own care and optimize your treatment and outcome. There are a variety of schedules and techniques used to deliver chemotherapy, and yours will depend on which treatment your doctor prescribes. Chemotherapy may consist of a single drug or combinations of drugs that are delivered in cycles. A cycle consists of treatment with one or more drugs followed by a period of rest. Currently, most chemotherapy is administered intravenously. In some cases, it may be beneficial to administer IV chemotherapy through a venous access device called a port. A port is inserted into a major vein in the body and can remain in place for a long period of time. However, for those that are undergoing frequent treatment, blood tests, and nutritional support, a port is beneficial by reducing the number of needle sticks and an associated discomfort. Chemotherapy drugs are typically given in cycles. The cycle consists of the day the drug is administered, followed by a rest and recovery period. A cycle usually lasts 1 to 4 weeks and is then repeated, which means the treatment is administered every 1 to 4 weeks. Each course of chemotherapy is different, but generally consists of 4 to 6 cycles. The actual administration of some chemotherapy drugs may take only seconds or minutes, while others may take hours or even days. In the past, chemotherapy drugs were mainly administered into a vein. Oral drugs may provide greater ease of administration since a patient can take them at home rather than going to the clinic or hospital for treatments. However, not all chemotherapy drugs are available in oral form and are not for everyone. One missed pill is like missing one IV. You cannot just digest another pill to get back on schedule. Furthermore, intravenous administration is sometimes preferable because the doctor can be more certain that the patient received the appropriate dose as scheduled and can monitor the patient during administration. Special precautions are necessary with a port. Your port must be flushed in order for it to work properly. Flushing your port requires placing a needle in your port and flushing it out with heparin. Heparin is a blood thinner that prevents the catheter from becoming clogged. While you are on treatment, your port will be flushed after each treatment. When you are no longer on treatment, you must still remember to have your port flushed regularly. This procedure needs to be done every 4 to 6 weeks. It is your responsibility to make the appointment to have your port flushed. Managing chemotherapy side effects. The treatment of cancer may include the use of chemotherapy, radiation therapy, biological therapy, surgery, or some combination of all of these therapeutic options. All of these treatment options are directed at killing or eradicating the cancer that exists in the patient's body. Unfortunately, the delivery of cancer therapy, including chemotherapy, often affects the body's normal organs and tissues not affected by cancer. The undesired consequence of damaging healthy cells is the complication of treatment or side effect. Side effects may be acute, chronic, or permanent. When cancer treatments are evaluated, side effects are measured and reported as part of the treatment evaluation. Examples of acute side effects include nausea, vomiting, and mouth sores. Why do side effects occur? Unfortunately, most chemotherapy drugs cannot tell the difference between a cancer cell or a healthy cell. Therefore, chemotherapy often affects the body's normal tissues and organs, which results in complications of treatments or side effects. Side effects cause inconvenience, discomfort, and may occasionally be fatal. Additionally, and perhaps more importantly, side effects may prevent doctors from delivering the prescribed dose of therapy at a specific time and schedule of the treatment plan. Because the expected outcome from therapy is based on delivering treatment at the dose and schedule prescribed in the treatment plan, a change from the treatment plan may reduce your chance of achieving an optimal outcome. This is extremely important to understand. In other words, side effects not only cause discomfort and unpleasantness, but also compromise your chance of a cure by preventing the delivery of therapy at its optimal dose and time. What are the most common side effects? All chemotherapy is associated with a wide variety of side effects. However, some side effects occur more frequently than others. Whether you will experience side effects, which ones, and other severity depends on a variety of factors, including your type of cancer, the type of chemotherapy drug or regimen you are taking, your physical condition, your age, and others. However, the following side effects are typically associated with chemotherapy: anemia, depression, fatigue, hair loss, infection or fever, low blood counts, mouth sores, nausea or vomiting, neutropenia, pain, reproduction or sexuality, thrombocytopenia, diarrhea, or constipation. Can anything be done about side effects? Fortunately, in the last 20 years, there has been a great deal of progress in the development of treatments to help prevent and control side effects of cancer therapy. These developments have led to a vast improvement in the management of symptoms associated with cancer treatment, allowed chemotherapy delivered with greater accuracy and consistency, and made many cancer treatments more widely available. For example, modern anti-vomiting drugs called antiemetics have reduced the severity of nausea and vomiting with chemotherapy. In addition, blood cell growth factors are now available to protect patients from infection, to reduce the fatigue associated with anemia, and to ensure that treatment can be delivered at planned dose and schedule for optimal outcomes. Understanding and monitoring your blood counts. A reduced number of blood cells in circulation is a common side effect of chemotherapy. Blood is composed of 3 basic blood cell types: red blood cells, white blood cells, and platelets. Blood cells are produced in bone marrow and regularly released into circulation. Chemotherapy destroys rapidly dividing cells, a characteristic of cancer cells. However, bone marrow cells also divide rapidly and frequently, damaged by chemotherapy. Blood counts are monitored with a laboratory test called a complete blood cell count, or CBC. The best way to treat low blood counts is to prevent them before they occur. This can be accomplished with administration of blood cell growth factors. In some circumstances, blood transfusions may also be necessary. Nutrition and cancer care. Eating the right kinds of foods is an important part of the cancer treatment, especially before, during, and after chemotherapy treatment. In order to feel better and help stay strong, a person has to eat and drink enough of the foods that contain key nutrients, such as vitamins, minerals, protein, carbohydrates, fat, and water. Some side effects make it difficult to eat well and interfere with good nutrition for many patients. Some of the symptoms include nausea and vomiting, diarrhea or constipation, mouth sores, and anorexia. Anorexia is a loss of appetite or desire to eat, which is one of the most common symptoms experienced. When any of these occur, malnutrition will cause the patient not only weakness, but difficult or impossible for one to withstand therapies. Another concern for poor nutrition is the ability to resist infections. Nutrition therapy may include one or more of the following: medications to help increase your appetite, supplement drinks that contain some essential nutrients. Certain cancer patients may require a feeding tube into the stomach or intestine. Our physicians at Palo Verde express the importance of good nutrition to help patients restore any nutrient shortages, maintain health, help prevent complications, and most of all, improve the quality of life. If you experience the inability to eat a regular diet, the following tips may help. Use supplements that are high in calories and proteins. Choose high protein and high calorie foods. Drink lots of fluids. Good sources of fiber include vegetables, fruit, whole grains, and beans. There are supportive drugs to help you when you experience these common side effects, which affect your eating habits and ultimately cause weight loss. Report your problem to our providers, who are our nurses, physician's assistants, and/or physician. We can prescribe for you medications to help prevent nausea and vomiting, diarrhea, laxatives to promote bowel movements, medications for mouth problems, and pain medications. When these occur, it's important to seek help so you can get back on a diet to include your protein and calories. By proactively understanding and managing aspects of your treatment, you can help ensure the best possible outcome from the treatment and maintain some degree of controlling your life. Work with your physician to select the best treatment for you. Don't forget that fighting cancer is not a challenge you should face alone. It is a team effort that involves family, friends, and your healthcare team. Don't overlook the strength that can come from having your support network by your side. Since a lot of information has come your way in such a short time, it is difficult to remember everything that may make a difference in your quality of life. You may keep this video to review or share with family and friends. Remember, you are not alone. We are here for you. We believe that every patient deserves the very best care. Here at Palo Verde, we have made that commitment. It is our life's work. That is who we are.